This video demonstrates the procedure for spirometric assessment of pulmonary function using a standard spirometer. This instrument is computerized and has been standardized in accord with the ATS procedures. It provides a visual and recorded trace of the patient's respiratory efforts.
Okay, my name is John Happy, and we're going to be conducting the spirometry test here. So what we're concerned about mostly is the total air that you can breathe in and force out, the volume, and then also how much of that air you can get out in the first second. Okay?
Spirometry is an active test. It requires training of the patient in the maneuvers needed to complete the test by the therapist, and it also requires the patient's cooperation to get the best possible result.
And the amount of time is important because there's still a little air left there. You feel like you've blown all your air out, but keep going for as long as possible.
Encouragement by the technician is an important part of the procedure, and the quality of the result depends on patient and therapist working together to get the best possible record.
Blow, 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 blow. Keep going, keep going, keep going, keep going, keep going.
The patient is usually asked to perform the test at least 3 times. Some patients have difficulty or are unable to perform the spirometry test because of weakness, illness, or lack of understanding. In that case, other approaches to the assessment of pulmonary function may be used. The procedures have been standardized by the American Thoracic Society. Many technicians who administer the test have taken a training course offered by accredited National Institute of Occupational Health and Safety training centers. The curves obtained are compared to select the best tests accomplished by the patient. Normal values for the computer-calculated components of the patient's efforts have been developed over the years. The computer will calculate the relationship between the patient's test and normals for his or her ethnicity, height, and age. The physician will then interpret these computer-derived values and explain their meaning to the patient and his or her diagnosis and prognosis.
So, you can consult your physician if you have questions or concerns. Thank you.
Again, it is important to remember that some patients have difficulty or are unable to perform the spirometry test because of weakness, illness, or lack of understanding. In that case, other approaches to the assessment of pulmonary function may be used.